friends, so now we're not talking about bands or loops or even elastics. I'm going to show you situations where you can just prevent the doing of bands and loops in order to correct something that you missed during your treatment. So before doing bands and loops, if we do the correct way of bonding our brackets or our tubes, we can prevent doing bands in order to correct something. So this is important because you want to do a smooth treatment, doing the treatment from the beginning to the end, right, like a line, you know, like doing everything correctly in order to do a very, very short treatment. So you are shortening your treatment line because you don't miss, you don't commit mistakes in the beginning of the treatment. So this is now what we are going to focus on, okay? Bends and loops. Let's begin with these two beautiful words for me. Bends are made in order to correct the positioning of a tooth or a group of teeth in three planes of space. They are named according to the movement they impose on teeth in first, second, and third order bands. Same thing with movements. So when we think about doing a first order movement or second order movement or a third order movement, we have to understand. We have to keep in our mind what we are doing. So let's establish from now to the end of the course what is first order, second order, or third order bands or movements as it matters. So night-tie wires may not be completely efficient to tackle some nuances of poor dental positions. So sometimes we have to do the bands in order to correct or in order to do a better movement or a smooth alignment or leveling of our teeth. So let's start with first order movement. This is the same thing that we're going to do during our course in order to understand the movements and the bands, okay? First order movement. So those are the movements that we see when you do the bands or correction, looking from behind our model, for example, from behind our upper or lower arches. So we do this movement, for example, when we correct the rotation of our tooth or teeth, and we do this kind of insets or offsets bands in order to correct the position of the alignment inside the arch wire, okay? Inside the arch of the patient. So we have the second order movements. Those are the movements that are made in the vertical direction. So when you see laterally our teeth or our model, we see the movements that we do in this situation. So angulation is a second order movement, and intrusion or extrusion are also second order movements. So we have the third order movement, which is the inclination that we impose to the teeth or a group of teeth or an individual tooth, for example. So we do the angulation, on the sectional part of our rectangular wire in order to create a couple that will correct the inclination of the tooth. So when we do this, we do a different inclination to our tooth or to our group of teeth, okay? So this is how we speak orthodontically. So this is how we create a unique vocabulary in order to communicate between me and you to do the correct movement and to understand what we are doing in our patients. So before doing this kind of movements, we have to understand that there are some topics that are very important in order to do a very correct, a very smooth treatment planning. And before doing the bands, we have to understand that we can prevent them, okay? We can't avoid doing this kind of bands because we did the right bonding, we did the right positioning of our brackets or tubes, and we anticipate the errors that could have been made during the course, and we completely eliminate those errors. Of course we can't. We can't eliminate them at all, but we can lower the amount of bends and loops that we have to do in order to correct something that was incorporated to the treatment in the beginning of the treatment. So let's do the thinking of not committing these mistakes, okay? This is what I'm calling you now to understand and to do with me. So finishing in orthodontics begins with the bonding of the brackets and tubes. We're going to talk individually about all those situations, the centralization of brackets and tubes. For class 2 and class 3, we're going to say something that is important, height of an angulation of during the bonding of the brackets and tubes. Those are very important also. So we're going to do this one by one. First of all, the centralization of the brackets and tubes. Why do they matter for us? Because when we commit mistakes during the decentralization, we're putting our brackets or our tubes outside the center of the teeth, looking obviously looking from behind, from above the models or their teeth. When you see these brackets, they are not centralized like this. We'll have something happening that we'll have to correct in some point of our treatment. For example, this kind here, this case here, we have the decentralization. It is not centralized, the bracket in the tooth crown. You can see that it's a little bit distalized. The bracket was positioned a little bit distalized. So what happened? It went, the medial part of the tooth, it went down, or in this situation, it went palatally, it went in direction palatal, okay? So what happened here was this, and now we have to correct. We can do this, we can do that very easily when you use bands, for example, a Z-band, a first order Z-band, but we are not talking about it now. We are just anticipating the errors. We are just trying to avoid the errors of the treatment, okay? So first thing, we have to centralize the bracket or the tube and the teeth, or the tooth, I'm sorry. So when we do this, when we do the centralization, the first thing is covered. We are not going to commit this kind of mistakes. We're not going to have to stop our treatment in order to correct something that we have done in the beginning of the treatment, okay? So this is important. Another thing that is important is to avoid the excess of composite in the base of the bracket. This is important because when you do this, we are incorporating we're incorporating something like an inset band, putting this kind of a rotation of the tooth going palatal, the medial part of the tooth, because the excess is located here, so it will work as an inset band, which we do not want in the majority of the case, of course. You may want that, but when you don't want this, what happens is that you have to correct. So in this case, you have this palatal movement of the medial part of the central incisor because you have this excess of the composite in the base of the bracket. So when you put the bracket, you have to make sure that you are squeezing the bracket against the bracket in opposition to the tooth. So it goes like this, and you have to remove all the excess that is incorporated during the bonding process. This is something that is very important, because when you commit this kind of mistake, you are doing something that you have to stop the treatment and to correct in some point of the treatment with bands or with rebonding the bracket, which is for the patient, which is not something that you would like to have, because you will have to correct, and we don't want that to happen. So we prevent this being very careful about the bonding process since the beginning of the treatment, okay? So we have here this excess in the medial part of the bracket, which is going to put the incisor it's going to input to the incisor a rotation, and this rotation will have to be corrected at some point of the treatment, okay? So this is a photograph of a situation like that, where the composite was in excess in the medial part of the bracket. So we had to stop and to do the correction of this thing that we did wrong. So we want to avoid that, doing the right positioning of the bracket since the beginning of the treatment. Okay, so centralization is very important, but Are there some situations where we won't centralize the bracket or the tube in our teeth, in our group of teeth, or in our tooth, specific tooth? Yes, we have. In class 2 or class 3 cases, we have seen that before. McNamara is very precise about that when he says that when we have class 2 or class 3 cases, we can put the bracket in a different position as that position that we are centralizing in a normal, in a class 1 condition, because this thing, this detail can change the position of the cusp in order to do the centralization of the cusp between two teeth, two opposite teeth, of course, and this part of the teeth that it sits and gives that beautiful intercuspation. Let me show you, because saying is not that important, but seeing is very important. Let's show it now. So if we have a normal situation, a class 1 situation, we just try to centralize, to put the brackets and tubes centralized in the crown, looking obviously in this occlusal view. So what do we do in order to, let's say, facilitate our intercuspation in a class 2 case? Think with me, if we just move the brackets medially in this situation, what will happen when we do this leveling of the arch, when we do this straightening of the arch wire? What will happen to those teeth where the bracket is not centralized? They will rotate. You saw that. You have seen this in the anterior part of this class, and when we do not centralize the bracket, we'll have a rotation. And in this situation, in which direction will rotate those bicuspids? They will rotate distally. So they will rotate in this kind of movement, bringing those beautiful tips backwards, bringing those beautiful tips distally. So this is something that will allow us to correct smoothly a class 2, and the intercuspation can be better when we do this kind of trick. Sometimes we think we're doing something to cheat the leveling and alignment, but it's not true. It's just a little trick that will help you to finish in a better intercuspation. And I have to admit that I do that often. I really like to do this kind of movement, because the intercuspation, the interdigitation of those tips in that position between two lower teeth, it's very beautiful. Let me show it now to you. This is an example in which I did this kind of medially positioning of the brackets. So you can see here that we move those brackets just a little bit forward in order to do the rotation of those crowns and to help the correction of the class 2 and a better and a beautiful intercuspation, as you can see here. So we have this class 2. Obviously, it was not just this tip that corrected the class 2. We had to do another thing. We had to do other things. For example, in this case, moving the mandible forward, and this patient used a forceps appliance to do the mandible, the anteriorization of the mandible. It went forward because of the forceps, but it helped when we did this kind of trick here, moving just a little bit forward, just a little bit medially, the position of the bracket. So in this case, you can see a nice intercuspation here between upper and lower premolars. So this is something that you can do just in order to help you to do a better intercuspation. Okay, so let me show you another tip that's very important for me. When we do the positioning of the bracket of the canine, something that I do very often is to move always, since the beginning, in class 1 or class 2 or class 3 cases, I move it medially. I move it towards medial, because when you do this, we do the rotation of the medial part of the tooth, and the canine, sometimes it not compensate the bracket, I'm sorry, it doesn't compensate the thickness of the canine compared to the lateral incisor. So when we do this kind of mesial, moving the brackets toward mesial, we do this kind of rotation, allowing to a better alignment of those teeth. So when we do this, we can prevent this kind of need of doing this bend, this first order bend, to correct the rotation of the canine, to correct the position of the canine. Let's see an example of this. So in this situation here, as you can see, the bracket is very mesial positioned, is mesially positioned, and when we do this kind of mesially positioning of the bracket, it goes with the mesial part of the tooth, it goes toward buccal. It goes this way, it goes buccally. So we can have a better alignment between those two parts of those teeth. So we have here the lateral incisor, the distal part of the lateral incisor, and the mesial part of the canine. They are smoothly aligned because of this position. Let's take a look to the other side of this very same arch. Let's see here what happened. Let's see here what happened because of something that I missed during the positioning of this bracket. I just put the bracket in the center, in an occlusal view. In the occlusal view, I put the bracket in the center of the crown of the canine. So what happened? The canine went lingually, towards distal in this position, or lingual in this kind of view here. So it went in this position. So what happened was a not soft alignment between lateral incisor and the mesial part of the canine. So of course you can correct this. Of course we can do bends for that or rebone the bracket. But if we anticipate this kind of mistake, we can do a treatment, more smooth treatment, without the need of going backwards in order to correct something that was not necessary to correct if we had this kind of care in order to do this positioning of the canine related to other brackets. Okay, so in this case, of course you can do the correction. For example, you can use here this kind of band. Is a first order band, like an offset. We can call this eminence band, canine eminence band. When we do this, just this shoulder here and the arch wire to put this tooth to bring this tooth towards buccal in order to correct the alignment in this kind of occlusal view. So we can do this, and to prevent the occurrence of this kind of disalignment between lateral incisor and the canine, we can anticipate this mistake, and we can do just this positioning of the bracket more mesial, towards mesial. So this is something that's very easy to do, and we can have the correction in this situation. Okay, so first part of our course, we're just trying to anticipate the errors. We're trying to tackle this kind of something that we do during treatment, that we have to stop treatment. We are avoiding this, just paying enough attention in the first part of our treatment with the positioning of the brackets. There are some other things that we have to do, but for now it's very good. Just think about it, and we come back and with more anticipations to avoid mistakes. Okay, see you later.